Good afternoon. My name is Nicole Kaufman. I am a consultant with Mercer, and we, along with Health Tech Solutions, are working with the Department for Medicaid Services to implement the Medicaid Advisory Committee and Beneficiary Advisory Council, which present a new framework for Medicaid beneficiary and external partner input. This is the second virtual forum on this topic. The first session was held on Monday. The background information as well as discussion topics are the same for both sessions. Next slide, please. All right, first, a couple of housekeeping items. Your lines are muted. You can submit comments or ask questions in the Q&A option at the bottom of your screen. Reminders on how to ask a question or make a comment during the discussion section will be repeated at that point. This webinar is being recorded, so please avoid sharing any protected health information. If you do need help with Zoom, please send a question to a meeting host through that Q&A function. And then lastly, please limit your questions and comments to today's topic, the Medicaid Advisory Committee and Beneficiary Advisory Council. Next slide, please. So I now have the pleasure of introducing Senior Deputy Commissioner Veronica Judy Cecil to welcome all of you today and to share some opening thoughts.
Thank you, Nicole. On behalf of Commissioner Lisa Lee, I would like to thank you for being with us today. Whether you're attending this live or watching it later, we appreciate you've taken the time to be involved in our efforts to include Kentuckians in this initiative to build on Medicaid's advisory groups. As Nicole mentioned, Medicaid has engaged Health Tech Solutions and Mercer as consultants to assist us. They are helping us to host today's forum and will be providing support throughout to ensure we are compliant with all of the new federal requirements. They have also done extensive research into other states. There are several states that already have a Beneficiary Advisory Council. So we're trying to learn those lessons and really identify best practices that we can bring to Kentucky to help us build our model and our structure. We've also tasked them to ensure that we are convening people with lived experiences, and we create a framework that is easy to navigate and permits meaningful engagement. You'll hear that a lot from us. We really mean it. We really want to make sure that our members and their family members, caregivers, advocates, community-based organizations, and of course our providers have the ability to engage with the department so that we are all working towards improving and building upon the successes that we've already seen in the Medicaid program, but certainly so we can do whatever possible to improve the outcomes for our members. Next slide, please. So our objectives today include hopefully lining out what those new requirements are and helping you understand what they are. We're going to discuss what needs to change with the current Advisory Council for Medical Assistance and the Technical Advisory Committee structure, what aligns, what doesn't. But I don't want you all to get focused on what the current state is, because we're really able to make changes that can be completely new and different. We want to hear from you on those key design elements for the MAC and the BAC. So this is the opportunity to provide that feedback. Really, there's all opinions are welcome here. We really want to hear from you all on the different pieces and components to make sure that we're covering everyone's desire for what we want to see the advisory groups in Kentucky to look like. So please take advantage of this opportunity, and we appreciate your honest and candid feedback. I will now turn it back over.
Thank you so much. I really, I guess, can't frame the purpose of today's discussion any better than that. So thank you. And then as a reminder, the presentation that we're going to walk through today, as well as a recording of both Monday's forum as well as the forum today, will be on the department's website. And then at the close of today's discussion, we're going to provide some information on a survey that will be available to provide your input. If you didn't have the chance to comment today, or have additional comments to provide. Next slide, please. All right, so what's new? Why are we bringing everybody together this week and over the coming weeks? So new federal rules require all Medicaid programs to have 2 distinct advisory groups that will be in place by July of 2025. So that's the Medicaid Advisory Committee, or MAC, and then the Beneficiary Advisory Council, or BAC. The new MAC and BAC framework is designed to promote the voices of individuals with lived experience with Medicaid and to really support diverse and representative advice to the department on the Medicaid program. This new framework also expands the focus areas for the MAC and BAC to advise Medicaid agencies on. And these focus areas include coordination and access to quality services, additions or modifications to benefits, the eligibility, enrollment, and renewal process, beneficiary and provider communications, and health disparities, health equity, and cultural competency. So what opportunities lie ahead? As Senior Deputy Commissioner Veronica stated earlier, Kentucky does aim to go beyond the federal compliance and checking off the boxes, right, to really enhance how input is received and to expand the perspectives on the Medicaid program. The aim is to work collaboratively to make sure the Medicaid program is the best it can be. Now, how is the Kentucky Medicaid program impacted? So these new federal rules will require some tweaks, right, to the Advisory Council for Medicaid Medical Assistance, which is Kentucky's current MAC structure, the creation of a distinct Beneficiary Advisory Council, and rethinking the Technical Advisory Committee framework as well. Next slide, please. So to understand what opportunities lie ahead, we will spend a few minutes covering the current Advisory Committee on Medical Assistance, as well as the Technical Advisory Committees. So the role of the MAC today, right, is to advise the Department for Medicaid Services on Medicaid health and medical care issues. Currently, there are 22 members on the MAC that serve a 4-year term. So what does that membership look like? There are 13 provider associations, 5 consumer advocacy groups, 3 Medicaid beneficiaries, and then Commissioner Lee. In terms of the provider associations that have a position on the MAC, you have the Kentucky Medical Association and association representatives for dentists, healthcare facilities, home health, hospice and palliative care, hospitals, medical equipment suppliers, nursing facilities, optometry, pharmacy, podiatry, and primary care. So quite a comprehensive scope of providers. Consumer advocacy representation includes individuals with disabilities, the elderly, women, minorities, and persons returning to society from incarceration. Members currently are appointed by the governor. The MAC meets at least every other month, and the meetings have been in a public virtual format, and those meetings are subject to the Kentucky Open Records and Open Meeting laws. All right, next slide, please. And I do acknowledge that there may be some hands raised. We will make sure to get to those once we get through some of this background information. So Kentucky's current technical assistance committees, or TACs, the TACs serve as advisors to that advisory council for medical assistance. Each TAC represents a specific provider type or are individuals that represent Medicaid beneficiaries. There are currently 17 TACs with 5 to 12 members per TAC, and then members serve until a replacement is selected. In terms of the representation across the 17 TACs, there are 12 provider types, 3 TACs that are beneficiary focused, and 2 which are hybrid. So they have a combination of both provider and beneficiary focused representation. So the provider associations that have a TAC, we have dental, home health, hospital care, intellectual and developmental disabilities, nursing facilities, optometry, pharmacy, physician, primary care, and therapy services. The beneficiary focused TACs, there's the consumer rights and client need TAC, disparity and equity TAC, and then the persons returning to society from incarceration TAC. And then the hybrid groups I mentioned address behavioral health and children's health. So members across the TACs are primarily appointed by their affiliated provider association or the advocacy groups. The meeting frequency varies. Typically it would be on a quarterly basis or more often. And then the meeting format, similar to the MAC today, public virtual meetings that are subject to the Kentucky Open Records and Open Meeting Laws. All right, next slide, please. So now we're going to shift gears and talk about the future, right? And what the new rules from the federal government require. So first, the Medicaid Advisory Committee framework, the role, right, similar to the today's MAC, and that's to advise the Department for Medicaid Services on policy development and administration of the Medicaid program. Now, the membership must include representation from at least one member across the following groups. So we have advocacy groups, clinical providers, Medicaid managed care organizations, and then other agencies in the Commonwealth that work with the Medicaid population. There is an expanded role within the MAC for individuals with lived experience in Medicaid, right? So as a Medicaid beneficiary, family member, or caregiver. And this means that members of the BAC, which we'll talk about next, need to have spots on the MAC as well. And the federal requirements say that by 2027, 25% of the MAC membership must be individuals that are on the BAC. So under the new framework, members will be selected by the Medicaid commissioner. The term, right, we'll work together to figure out what that term is, but the federal government says that members cannot serve back-to-back terms. The MAC will need to meet at least quarterly, and then at least 2 meetings per year must be public. So a couple of points to highlight, talking about current state versus what will come in the near future. Right, the advisory role of the MAC is similar to what happens today for the Advisory Council. The MAC will have expanded membership, right, to include MCOs, the health plans, and other agencies within the Commonwealth, as well as individuals with lived experience with Medicaid. So some BAC members, right, must also be on the MAC. The process for how members are selected will change. And then the MAC will they'll create an annual report that covers the recommendations from both the MAC and BAC, the activities over the year. That report will be on the department's website, and then will also be submitted to the federal government. Next slide, please. Okay, now let's talk about the Beneficiary Advisory Council. So the BAC is a dedicated and supported space for individuals with lived Medicaid experience that will identify issues, right, to work through for the MAC, and will directly advise the Department for Medicaid Services. Membership is comprised of current and or former Medicaid beneficiaries, their family members, and paid or unpaid caregivers. As with the MAC, members will be selected by the Medicaid commissioner. Also, same as the MAC, members cannot serve back-to-back terms. Now, because the BAC has a role of supporting the MAC and advising the MAC, right? The BAC needs to meet separately from and before each MAC meeting. And then they can also meet as frequently as they deem necessary. And then that meeting format, the BAC can decide which meetings, if any, are open to the public. So just to emphasize here, BAC membership is limited, right, to individuals with lived Medicaid experience. And then, as I noted, BAC meetings do not need to be public if that's the desire of the BAC members. Okay, next slide, please. All right, so now it's time to talk through all of the design elements, right, or some key ones for both the MAC and BAC. And to help with that discussion, I'm going to turn it to my friend and colleague, Shannon Kojisoy.
Great, thank you, Nicole. So as Nicole just provided an overview, we walked through the new federal requirements. Then she shared some details on the current advisory committees, the MAC and the TAC, and then moved into some of the key areas to highlight as we look to the MAC and BAC and compare that to current state. These next few slides are our opportunity to hear from all of you and gather your feedback to help inform the key design areas of that new MAC and BAC. And so we will focus those slides, the first on MAC membership. We will then ask about BAC membership. We'll look to the length of the appointment for both the MAC and BAC, discuss meeting frequency for the MAC and BAC, and then close out the discussion looking for your feedback on support for the MAC and BAC. To conduct this discussion, I'll look to you to raise your hands to provide feedback on the questions we are providing, but also feel free to provide your feedback in that Q&A function at the bottom of your screen. Nicole Como, our other colleague, will share that and read that information off on your behalf, so we can make sure that everyone in this virtual room can hear ideas from each other. So again, feel free to raise your hand. I will call on you and we will take you off mute in order that hands are raised, but also feel free to answer those questions in the Q&A, provide the feedback there, and we'll read it off. Excellent. We can move to the next slide. So our first question to all of you is concerning the MAC membership. As Nicole had shared, there are currently 22 members on the MAC. So we can pull in actually both these questions. Would like to hear from you and those of you who are possibly participating on either of the current advisory committees to share a little bit about how this is working, how MAC membership is working. Does it seem like the right size? Is it too big or is it too small? And so again, would love to see some hands up. It's always nice to hear some voices, but feel free to put that in the Q&A too. Great, I see John Keynes, you have your hand up. I think we're off mute. John, can you?
There we go. I couldn't
Perfect.
see them earlier. I appreciate you for letting me in to participate. My concern was more along the lines with the behavioral health side. I'm a person in long-term recovery myself, and I work in substance abuse treatment now. And I'm curious as how this advisory committee and moving forward, how this will affect those services that we provide. More so along the lines of, we see a lot of kind of revolving door people. We'll have a participant come in and they may stay 90 days, 6 months, and go back out to their living situation, and they may be back in a couple of weeks because of a relapse or some other sort of crisis in their life. And I'm curious as how that will affect those people in particular.
Great, thank you for that, John. And so it sounds like you want to make sure that that behavioral health voice is part of this membership on the MAC. Oh,
Yeah, that's definitely what I was curious about.
okay, Great, thank you for that. We will include that as a recommendation and may have some questions later we'd like you to jump in on as well to make sure we capture that feedback. I also see that Caroline, or Carolyn, excuse me, has your hand up. Carolyn, are you able to speak?
I can hear you, Carolyn, but you're very, very, very quiet.
Okay.
Is that any better?
Oh,
Yeah.
that's wonderful.
Okay.
Yes.
Sorry about that.
That's all right.
So my name is Carolyn Bassford, and I work for Pediatric Home Service. We're in the home medical supply business with equipment and supplies. I also serve as I'm the incoming president of KMESA, which is the Kentucky Medical Equipment Supplier Association. So, currently, as we know, the current situation, we do have DME or HME company representation on the MAC. However, as far as with the current tax situation, there's really not a voice for medical equipment suppliers. I just want to make sure that we do have a voice on this committee, because I serve the pediatric population of really high tech, really sick kiddos, but there are several of many companies that do mainly adult business and some pediatric business. And unfortunately, our industry is losing members, losing companies due to the fact of decreased reimbursement, and it's resulting in access issues for patients, especially the Medicaid population and throughout the Commonwealth, because we all know the rural areas. So I just want to put that out there to make sure that the DME supplier, that we will have a voice on this membership committee.
Excellent. Thank you for that, Carolyn. And now we can move. I see we have a hand up by Sharon. Your feedback? Sharon Branham. Sorry, I should use last names. We've got a couple Sharons with hands up.
Hi, my name is Sharon Branham, and I have 36 years of home health and hospice experience. I served on the MAC for, 6 years, and representing home health agencies in Kentucky. And I was chair of the TAC for, 4 or 5 years. When I served on the MAC, the issues I saw were that some of the times the beneficiaries would change frequently because of travel issues, of getting to Frankfurt and things like that. And again, I don't know who submits those names to the governor for approval for seats on the MAC for the beneficiary, but I do know that it was difficult for their voice to be heard because of the fact that, they couldn't be consistent enough to follow through on things, and not being a TAC, not having a TAC group for them, they couldn't make recommendations. So that's something I think will have to be looked at. The speaker before me, medical equipment services were not represented, and home healths and hospices work frequently with medical equipment companies, and the pediatric population that home health and these equipment companies serve in conjunction. So there needs to be some relationship there as well on the MAC.
Thank you for that.
Oh.
Maybe you're getting to it, Sharon. I just wanted to ask one question before you drop off. With your experience on the MAC, how did that size, that membership, feel to you in your experience? Did it feel the right size? Too big? Too small?
I think that the size, you're going to have that size or a little larger. I know I spoke to Brandy Cantor of the of the Hospice Association the last week at our board meeting, and I asked her if a name had been submitted yet. And she said no, but she would follow up. So that was a whole group that has not even been represented on the MAC. And the difficulty that we ran into for those years I sat there was having a quorum. So I believe that you're going to have to consider the number and what it takes to have the quorum in order for the tax that present to the MAC for motions to be made about actions suggested to the Department for Cabinet and Health Services.
Great. Thank you for that, Sharon. And I'm going to just slide in the next set of questions. Those of you with your hands up, we want to hear from you. I just am hearing many of you also providing some direction on those voices you want to see on the MAC. And so I thought, let's bring that into this discussion. So there are currently 13 provider associations, 5 consumer advocacy groups, 3 Medicaid beneficiaries, and the Medicaid commissioners also on the MAC. And so just as you're providing your feedback on that size, also feel free to build on that and provide feedback on groups. As has been noted so far, we've really heard support for that behavioral health voice, the medical supplier, and the home health. And so just want to hear from all of you on that as well. And so I'll hand it now to Sheila Schuster. Would you like to share your feedback? Sheila, are you able to speak up?
Talking to you. Let me try it again.
Oh, now we hear you.
Oh, okay,
I think there must be a delay for everyone. So sorry about that.
And there were several buttons to press for unmute. So apparently I only pressed one of the 2. Anyway, I'm Sheila Schuster. I'm currently the chair of the MAC and have been in this position for the past year. There is definitely a lack of behavioral health. We didn't even have a behavioral health TAC until about 10 or 11 years ago when we went to the legislature and created it. And I'm only on the MAC because I was appointed as a consumer advocacy group for minorities. And I'm not real sure how I qualified for that unless you want to look at behavioral health as being a minority population. But there is no provider group for behavioral health. And the behavioral health TAC is very active. We have 2 consumer representatives as voting members out of the 7 voting members that we have. So we value the consumer voice. We have not had a problem with quorum, but we have been meeting by Zoom. And the advantage of Zoom is that people can get to the meetings. The disadvantage is that you don't have the before and after really getting to know your fellow MAC members and so forth. And I certainly could see pros and cons, but I am aware when they used to meet in Frankfurt that very often people couldn't get there and they didn't have quorums. So there's kind of a trade-off, I think, in that. I find that the working group of 22 members to be workable as the chair. I send out communications to them, and those that are active on it, will give me some feedback, and those that are not, but I don't know that it's a function of the number of people. We, I think, are underrepresented, as you pointed out. We only have 3 Medicaid assistant recipients on there, and obviously I think this move to have a BAC and to have more Medicaid beneficiaries or their families or their caregivers is certainly a positive move. But I would second what Mr. Karen said to start out with, that we need a designated seat for behavioral health as a voting member of the MAC. Thank you very much.
Yeah, thank you, Sheila. Thank you for sharing that, and a great perspective to hear. Excellent. Now I think we see Rachel Nadel. We'll take you off of mute. Oh, we may have lost you. I think you just fell off. Raise your hand again if you'd like to come back. Otherwise, we'll move to Sharon Hoffman.
Hello.
Yes, Sharon, we hear you.
Hi, I'm Sharon Hoffman. I'm 70 years old. I am a participant in the Medicaid system and have been probably since I was about 61 years old. The biggest problem that I see is particularly women with my age group, from say 60 on up. Most of us are either widows or divorced women, pretty much on our own. And I feel it's a very underrepresented group. It would be nice to have some person or somebody to speak for our group, because I've helped several women who were in their early 60s navigate the Medicaid system. And like I said, I was on the Medicaid system. Then at 65, of course, I went on to Medicare, but I am still technically under the Medicaid system because I am very low income and the state pays my Medicare premium. And again, it's really, really hard for women in my age group to be heard. And so if I could ask for anything, I would like to see a seat open for, and not just women, men too, but I would love to see a seat open for elderly over 60, even over 55-year-old women and men that, because I know myself, we need help. I'm very good at navigating the system, and even I get tripped up sometimes. So that's really all I need to say or want to say. If anybody has a question for me, I'd be glad to take it.
Thank you, Sharon. And I'm seeing some support from the virtual room, from the emoji screen, that it seems others agree with you there. So we will be sure to capture that. Thanks so much for sharing. I think Emily Beauregard.
Yes, that's right.
Yes.
Emily Beauregard. Can you hear me?
Sure. Yes, we can.
Thank you. I'm the director of Kentucky Voices for Health. We're a consumer health advocacy group, and I currently chair the consumer TAC, which of course I think is very similar to the Beneficiary Advisory Council as it's being envisioned. And I think the BAC would be a bigger and better version of the consumer TAC. But what I wanted to comment on in terms of the MAC makeup, and I know saying BAC and MAC can be a little confusing. I think that the number of, currently 22 members, if I'm doing the math right, we'd need to have 6 beneficiaries in order to meet that 25%, and increasing the MAC by at least 3 members to achieve that, I think is very reasonable. But to Sharon's point, and I think she made a very, very good point, looking at diversity of representation is also important. And so I'd like to see, and I think Dr. Schuster and others made points about, various needs and lived experience. And so looking at someone who has that behavioral health lived experience, someone who is maybe an older adult with Medicaid benefits, someone who is a parent of a child with Medicaid benefits, looking at geography, but really trying to make sure that we are representing the full, or if not full, at least a diverse range of the Medicaid population. And then recognizing too that, of course, the BAC will provide the opportunity. If we have 6 beneficiaries on the MAC, then we would have 24 as the Beneficiary Advisory Council, in which we could even, expand that diversity more. But I think that's important. And then I would add accessibility and accommodations are going to be incredibly important for meaningful participation. And right now, I don't think the format of this meeting is that accessible. I'd love to see an open chat so that people could be not only typing in comments if they aren't able to unmute and talk, but also just so that everyone could see each other's comments and feedback. But beside that, I think we need to look at both in-person and virtual options and other types of accommodations, interpreters, personal assistants, anything that an individual would need in order to be able to participate, and having some more one-on-one sort of support from Medicaid staff is also going to be important for that participation, so that people can be prepared for meetings, can get background and sort of more of the context on different policies and programs.
Excellent.
And
Thank
with that,
you.
I'll wrap it up. I have more to say, but it doesn't necessarily answer the questions that you've got on the screen right now.
Well, and Emily, those questions are coming, so jump on again. But we have captured a lot of your great feedback now, because we're looking for that support feedback and some feedback on the back as well. So thank you for sharing, and don't hesitate to raise your hand again when those questions pop up if you have more to add. And I'm seeing a lot of support from folks as you've been speaking, so I think a lot of in the room agree with you. We'll take one more question before we kind of bring in one more person to provide feedback before we bring in our last question. Rachel, Nadel?
Yeah. Can you hear me?
Yes.
Oh, good. It worked. Yes. Thank you very much, Rachel Nadely. Don't worry, nobody ever gets it right the first time. There's a lot of vowels. I am so happy to be here. Thank you for inviting me. I'm a single mother and I'm a caregiver for my paralyzed son. I know you're trying to wrap this up, so I'll keep this short. I'm very excited about hearing about this. I have a lot of suggestions. I've been my son's caregiver for about 10 years. We survived a car accident that paralyzed him. And we're waiver. So he's disability, he's Medicaid, I'm waiver, and I also receive Medicaid, being in low income single mother. I absolutely think that there's too many cooks in the kitchen. Absolutely. And there are definitely groups missing. So I would love to please sign me up to be on the MAC or the BAC or whichever one. I have some absolutely fabulous solutions, because we are adaptive warriors, and I truly believe when we focus on the problem, we'll keep getting the problems, but when we focus on solutions, we'll find solutions. So I'm very happy that you all are doing this. Thank you.
Well, thank you, Rachel, and thanks for those encouraging words. And please jump in and continue to provide your feedback as we move through these next round of questions. Because as we are designing it, we want to make sure we hear from all of you, especially those of you with an interest to possibly sit on the new MAC and the new BAC. So we'll bring in the next question. And so this is just kind of exploring the idea of subcommittees. So using subcommittees could be one way to talk about topics in more details. It may also provide more opportunities to participate in this process. So we've heard for some of you, like as was just shared by Rachel, too many cooks in the kitchen, maybe at that one table. Subcommittees might be a way to hear those voices in a different format. And we've also heard that there is a desire to make sure that other voices are being heard that currently are not. So just wanted to inquire of all of you to provide your feedback on what your thoughts are about using subcommittees as part of the MAC. Please provide opportunities and challenges, and also feel free to just type your feedback in the Q&A, and Nicole will read those off. And I actually will just hand it over to Nicole real quick to check in to see if we have received any feedback on membership from those in the Q&A.
Yeah, thanks, Shannon. And thanks everybody who's been participating orally. I think we like to have the opportunity for folks on the back end to provide feedback and also make sure they can do that with anonymity if they feel more comfortable doing that. So we've seen a few additional groups come in through the chat that want to speak to ensure they have representation as well. Chiropractic, elderly groups representation, rural and urban representation, and then adult day health. So looking at each of those, and again, comments on both sides of the coin. The size is good as it is. It could be bigger to make sure groups are participating or all represented. And then also some saying it would be easier to make decisions if it was smaller. So across the board, and I think it's great to see all of those different pieces of feedback as they come through. I don't see any hands, Shannon, so I'm going to scan again and see if anything has come in on your new question.
I see Emily Beauregard just raised her
yep.
hand again.
Beauregard, yep. There you go, Emily. You should be able to speak.
Thank you. I was typing it, but I thought I might as well say it. I think it's easier for folks who are participating to just hear from us. I think a subcommittee structure could be really valuable to the way that the tax currently operate. There are 17 or is it 19 tax now? I think that there's a lot of overlap with the provider tax in particular in addressing issues related to billing and coding. And while those are important, I think they could probably be maybe even better addressed through more of a subcommittee structure in which, you know, that is the focus of the subcommittee. Whereas we could then focus on services, on access, on quality with other subcommittees and it not be so imbalanced. Because as I see it now, you know, the consumer TAC and the behavioral health TAC, the reentry TAC, there's a health equity and disparities TAC. Those have a little bit more of that consumer representation, more focus on, you know, services, on access, on some of the barriers that people experience. But there really is an imbalance in dealing with some provider issues, and they tend to be around billing and coding. So I'd like to see, you know, those different kinds of topic areas in a subcommittee structure so that we can also just kind of reduce that duplication or the things that really overlap from one provider group to another. And I think it would help just the functioning of the MAC and tax generally. And then, you know, that would also give the BAC, I think, a little bit more distinction in what it's doing.
Thank you, Emily, for sharing that. And I see two other hands up. We'll take your feedback and then we'll move to the next questions, but don't rush your feedback. We still want to hear from you, just kind of teeing it up. So Sheila Schuster, what's your feedback?
Yes, and again, I'm the chair of the MAC. I think subcommittees would be great. I am actually quite disappointed in the number of TACs we have and how little they contribute to the MAC discussion. We give them time at the end of each MAC meeting, and most of them have gone to quarterly meetings, which is certainly their decision. But I would say, with the exception of behavioral health and the consumer TAC, typically the physician TAC, most of the TACs do not give us any fodder for our discussion. So I would love to have subcommittees that focused on accessibility. I've been trying to get the MAC to focus on how can we make Medicaid in general and the waivers in particular more accessible to the consumers of Kentucky. And I've gotten very little feedback from the MAC members. So I'm wondering if a subcommittee structure that was perhaps open to persons other than those appointed to the MAC might actually give us some of that discussion and some of the work. Handled a language access issue by keeping it on the agenda for meeting after meeting after meeting, and finally working directly with Medicaid and getting the MCOs to finally make some presentations to us, but it was a long drawn out process to do it that way. And I wonder if we had had even an interim committee on language access, if they couldn't have come up with that and made a presentation to the MAC and had a discussion there. So I'm all for having subcommittees as part of the MAC structure. Thank you.
Great, thank you, Sheila. Good to hear that feedback. Nicole, did you have something to share?
Yeah, I think we had one individual who was trying to raise her hand, Catherine Hannah, and wasn't able to. I wanted to try to allow you off mute, Catherine, if you wanted to share your question, and then I'll have 4 other hands we can try and capture in this section. Catherine, can we hear you?
Can you hear me?
Yes.
Can you hear me? Okay, yeah. This is Catherine Han. I actually serve on the MAC committee right now, and have been for, I guess this is my 5th year, I believe. I'd have to go back and check. But I just wanted to speak to the value of having all the current MAC members, and so I hope we can, retain that all of those different disciplines. And the reason for that is I feel that each, particular MAC not only brings their own perspective, based upon their discipline, whatever that is, but they that they represent, but we all come to the table and learn about what the challenges are in other areas. But as we're doing that, we do represent and advocate for the beneficiaries that we each serve. And I think that's important because every provider group might have a different perspective, and hearing from others is important. And so I think that interaction between all of the groups too is very important. As we kind of join together and try to advocate for all the beneficiaries that we serve, because that's our goal. So I just wanted to bring that forth just to, say, as we look at this, I think it's very important that we do include many of these provider groups, because we don't all work in a silo, right? So we need to hear from everyone as we go through. But thank you. Appreciate that.
Great. Thank you, Catherine, for that. And for anyone else having difficulties raising their hands, just do the same, put a note in the Q&A. We'll make sure to take you off mute. And then just due to time, we're gonna have one more hand raised. And then Brian, I see your hand up. We'll make sure to get your feedback on the next slide, or you can add on then. But Sharon Hoffman, you had your hand raised.
Yes, ma'am. It's Sharon again. I come out of both private business and public. I did a lot of years doing government bids and working in private and public business. I'm not against subcommittees. I actually think subcommittees could work in a good way, but at the same time, sometimes subcommittees, and I know this from dealing with government agencies, they tend to get a little bit neglected, and I'm not sure if that's the right word, but because they are a subcommittee, they are not the committee. So a lot of times it's like, who's really going to hear me? So I'm not against a subcommittee, but if you were going to go to a subcommittee format, it would just be important to know that those subcommittees are actually being heard by the MAC or by the main committee. And that's my 2 cents worth.
Great, thank you, Sharon. I appreciate that, and a great point to raise. Just a caution, and really will help that design structure to be cognizant that the subcommittee has some power and a real voice. So thank you for that. We will move to the next slide, but again, we'll still go in order of the hands up. But just wanted to bring in another item for this group's discussion, because I want to make sure we get through all those slides if we can. And this really is specific to the BAC membership. So that beneficiary advisory. And so there are positions on the MAC and some tax for individuals currently on Medicaid with specific callouts for parents, individuals with intellectual and development disabilities, and caregivers, and individuals re-entering society following incarceration. We've heard from quite a few of you already about those behavioral health voices and elderly adult voices that you want to make sure are called out and have a voice. And so would love to hear from you about Are there other lived experiences with Medicaid that should be included? And let's bring in the next question too, just due to timing. Also, considering of the role of the BAC, do you have any suggestions around what a good-sized membership for the BAC would be? And so now I'll open it up. Please raise your hands or again, provide that feedback in the chat. And don't be afraid to speak multiple times. We like to hear multiple voices. And I will hand it off to Brian. I see you have your hand up. Brian, are you off mute? Brian Lebanania. No, oh, I'm sorry. Now you're making me have to say that last name, and I apologize. I'm going to not do it right. Nicole, are you hearing
Hi.
anything? Sorry.
Can you hear me
No,
now?
no, sorry.
Oh,
Oh,
there we
go.
heard you.
Hi, Brian.
Can you hear me? Perfect. Sorry,
Yes.
technical issues. I was just saying I was trying to be a little more quiet than I was on Monday, just to give more opportunity. But I did want to reiterate what was just said about subcommittees. I think sometimes when you get a subcommittee, that it can become just a silo, and really those individuals are not going to get heard unless they have the full audience. But also, there were some comments made earlier about access, and I think, as I've thought about this a couple of days now, that maybe the structure of the MAC should be really focused on, rather than making sure we have provider representation, and that we actually, make it, about an education. These people are going to provide education, not just for their industry, but for the state and for the Medicaid program. My thought is, we should have one on the HCBW program, because my recent experience, that is a very difficult program to navigate. Back in the late 90s, when I was in the industry, it was so much easier, but now there's so many different people you have to go through. There's not a lot of providers. There's a lot of misinformation regarding the HCBW program, and there just needs to be a lot more education done to the communities, and not just the beneficiaries, but the healthcare communities and the legal communities, about what the programs in Medicaid are supposed to provide. And I think there's a very large deficit there. So maybe we need to re-envision the whole MAC. And Sheila, I heard you talk about access, and I wanted to jump up and down, because we should be able to take that MAC and really delve into the access issues across the state, and do something about those. So, it's about education, and it's about understanding the programs, and it's about educating not just the beneficiaries who have to apply, but in my experience, it's educating the people who case manage, and the people who perform those other roles, on what is available, how people qualify, and what services are available. So that's my comments, and that brings me to the BAC. Again, I'll reiterate my comments from Monday, that I think the BAC needs to be a very, very integral part of this whole entire process, because I think some providers honestly are great advocates for patients, and I heard that earlier, and I appreciate that. But if you are an individual and you don't know where to turn, you have to be able to have a voice, and that, I think, is where the BAC would come in. So thank you very much.
Great, thank you for that, Brian. And it sounds like too, there is a lot of, like, you're kind of suggesting that relationship with the BAC, between the MAC and then those individual voices that are just so important to hear on the BAC. And so I see Sheila Schuster, you have your hand up. Do you have feedback on the BAC membership? Probably pulling on your experience with the MAC.
Yes, I do, because one of the things that I've done as the chair of the MAC is to bring the Medicaid waivers into the discussion. Prior to that, the waiver programs were not talked very much about at the MAC level. And when you look at the number of people involved, the fact that we've got 12,000 people on the waiting list for those waivers, and the amount of money, I think the BAC membership needs to keep an eye on representation of both those in, if you will, regular Medicaid, and those who are on waivers.
Okay.
So that would be one thing I would say. I think if you're going to have representation geographically in terms of racial and ethnic backgrounds, which we didn't talk about with the MAC, but we really need to focus more on representing so that our BAC and MAC really look like Kentucky in terms of racial and ethnic backgrounds and so forth. I think you're going to have something probably of the same size as the MAC would be my suggestion. So that 20 to 25 to really make sure that everybody on there is representing a perhaps slightly different. And I would think you would want to have a mix of, you know, in the behavioral health world, we call them consumers, but the beneficiaries themselves, as well as family members, as well as caregivers, because you have a different perspective.
Excellent. Actually, and on that, Sheila, we'll pull in our last question because we'll want to move into some of our next slides too. But while you're still here, that is our next question. So I'd love to just get your thoughts on that. Is looking at, I hear from you, you want that those representatives who, for beneficiaries who are on the waiver, making sure it's geographically and racially, ethnically representative of Kentucky. And then when you reference that mix, so our question is, yes, federal regulations will require that these members are current or former Medicaid beneficiaries, family members, or caregivers. Do you recommend that there should be a balance between Medicaid beneficiaries and family members and caregivers? It sounds like you do. And do you have a percentage that you would recommend there?
I hadn't thought about a percentage, but I do think, I mean, you know, as a starting point, I'd probably say maybe half beneficiaries, the other half divided between family members and caregivers. You know, what you get into, you know, some beneficiaries are going to have trouble participating or communicating without somebody there as an aid. And Emily brought that up in terms of the consumer tax. But I still think that pure, if you will, consumer or beneficiary voice is really, really important. Not to denigrate in any way the family members and the caregivers, but I would probably look at half being the consumers themselves, and then the other half family members and caregivers. And I don't know that it has to be a set percentage between those two. I always favored the family members, quite frankly. We work closely, of course, with NAMI and our family member groups in behavioral health, and because they're the ones that are negotiating the system on behalf of their loved one. And they often know the problems at the accessibility and enrollment and keeping benefits and being an advocate. And those are the voices that we want to hear, as well as the actual lived experience of the beneficiary. So thank you for this opportunity. I appreciate it.
No, thank you for sharing that, Sheila. That's great. And I see a hand up from Sharon. Real quick before I hand it over to you, just checking in, Nicole, if we had any feedback provided in the Q&A for the BAC membership that we want to speak to.
The only additional comment that we see on BAC membership at this time is around duals participation as part of that group with kind of lived experience. So I will go ahead and shift over and take, looks like Brian off of mute.
Oh, I think Sharon was next, or sorry, Brian, unless you had your hand up again. Oh, yep. I think it's Sharon Hoffman.
Okay, let me switch. There we go.
Yes, thank
Sharon,
you.
you should be able to talk. There you go.
Yeah. Hi, Sheila. Which part of what Sheila was saying, I think is good about family members and caregivers. One thing you have to realize with older people, and it seems like particularly older women, I know I'm kind of harping on that, but as an older single woman who has no children, and I have friends who are older women who their husbands have died and their children don't really help, it falls to friends and things like that. Again, in my situation, because I'm good at navigating systems, the people I've been helping may not be family members or my direct family members, but they're kind of like family to me. So, and nothing against family members, because family members can be very good, but sometimes, particularly with elderly people, there are no family members necessarily available, and and caretakers, again, aren't necessarily family, but they are caretakers, kind of. In like with my situation, I have a very dear friend of mine who's 61 years old and has Charcot foot, and is battling this whole system, because she can't, I can't take her anywhere. So, but again, it's family's great, caregivers are great, but realize, particularly when you're talking with elderly people, sometimes there's not a family member and there's not even a caregiver. Sometimes that's my situation, because I do live by myself. I take very good care of myself, but again, trying to find somebody, because I do have health issues, and I will need surgery in a couple of months. And I'm trying to think of, okay, who am I going to get to come in here and help me? And it's going to end up falling to all my friends again. So with that, I will let that go.
Thank you, Sharon. No, it's a great point to raise, to be as expansive in this language, really to make sure that you have that expansive representation. So no, thank you for sharing that. And we can move to the next slide. Nicole, interrupt me if we have any other feedback. Okay. We'll move to the next slide. We've got 3 more slides of questions we want your feedback on. This one is the MAC and BAC member length of appointment. So members cannot serve back-to-back appointments in the new MAC and BAC. Currently, members on the Advisory Council for Medical Services serve 4 years and may have back-to-back appointments. So this means they can serve for 4 years and then serve another 4 years right after that initial time period. And so just wanted to hear from all of you, what do you think about the length of time members should be appointed to serve on the MAC and BAC? Is 4 years sufficient? Is it too long? Is it too short? And then how does the length of time the members on the MAC and BAC impact that role? So feel free to provide context and support for why you recommend a certain length of time. So again, feel free to just type your answer in the Q&A and we can read that off, or raise your hand. We'd love to hear from you. Sheila, you have your hand raised?
Yes, I'm sorry to talk so much, but I have lots of opinions.
We like to hear it. Great.
Running a TAC and serving as chair of the MAC. I think a minimum is 4 years. I'm actually quite disappointed that they've said that you can't serve back-to-back terms, because I think there's such a learning curve, and I really worry about the people, particularly on the back, who are coming into this without even a glossary, an understanding of what the terminology is. I mean, it takes new members of the MAC, I would say 18 months to 2 years to really get a good feel for what the MAC is supposed to be doing and who all the players are. And I can't imagine, most of us are very active in our tax, so I can't imagine what it would be like for the BAC members. I would be tempted to say, give them the U.S. Senate terms of 6 years if they can't serve back to back. You may lose some people. There may be some particularly BAC members who are like, wow, that's a long time to make a commitment to be on a committee. So I would be open to feedback on that, but I would, if we're going to go to, you can't serve back-to-back terms, it's got to be at least 4 years. And I would look at 5 or 6, actually.
Excellent. Thank you for that, Sheila. So it sounds like you're recommending 4 to 6, and we will get to a slide about support. And you raised some great options there too, to just ensure that members feel like they can participate. sooner. So thank you, Sheila. I see Valerie, your hand is up.
All right, can you hear me?
Yes.
Okay. Yeah, I serve on a parent advisory council, and we've just done something like this in creating a term limit of how long. One of the things that we've done, and I think would be really important, because you're right, it takes a long time for somebody new who doesn't know the terminology. This is a brand new meeting to me, and all the initials and learning what all that means. I've got a whole page full of notes of alphabet soup here. So, but having somebody who when understanding that as you're rolling off on that 54th year, 50th year, 60th year, whatever, that it might be your job to take on in a mentorship role some of the new people coming on, so that they can have somebody that they can contact about questions and get some guidance, those kind of things. That way it helps to shorten that process of coming on and getting acclimated to the system, and learning what your role is and what you're supposed to do.
Great. Thank you for that, Valerie. Great suggestion about a mentorship role. And it sounds like you're still kind of staying that 4 to 6 year range. Emily, your hand is up.
Yeah, so I would absolutely second what Dr. Schuster recommended, and also what Valerie just suggested in terms of a mentor. I think that's a fantastic idea. And I think between 4 to 6 years for serving is also a pretty good range. My question, I guess, is, I was just thinking about, as you joined the BAC originally, I think, or at least initially. So you become a BAC member, and then let's say 2 years into your membership, you're appointed to the MAC. Would you only then, let's assume it's a 4-year term. Would you only then serve 2 years on the MAC? Or could we have a range of service, maybe 4 to 6 years, where if you're appointed to the MAC, you serve, out a more extended term. I'm just thinking off the top of my head, but I think having maybe a range, and that could also be good for people who want to serve a 4-year versus a 6-year term, to give them that option, but to have a little bit of flexibility there.
Excellent. Thank you for that, Emily. And yeah, it sounds like a range of services, and then maybe having that rotation, which might mix up some of the experience on the committee as well.
And then just one more suggestion, I think, to the Valerie's point about mentors, having a more in-depth orientation and more extensive, I think would be helpful. We did, through the consumer attack, we worked with Medicaid staff to create an orientation sort of presentation packet. But I think having more of a, day-long orientation with background on Medicaid, with the opportunity to talk with different staff and just really start to develop those relationships would be helpful.
Well, thank you for that, Emily. That is great to hear. And then the last hand up I see for this slide anyway is Sharon Branham.
Yes, I would. Emily kind of beat me to it, but I know that when I was appointed to the MAC, there was a long delay in the submission of name. Well, let's say that the member for the Home Health Association had resigned, and then the association submitted the names for the governor to choose. And there was a fairly long period of time, because when they only meet quarterly, then that can be a long period of time before they actually get to the door to the MAC. And I was kind of just thrown into it. I was able to educate myself, but I think a day-long orientation of exactly what is your role, like Emily had mentioned before, and I guess they were proactive in getting an orientation packet together for the next person, would be really, really valuable. And I know that it could increase the productivity and the confidence to speak up at the MACs if you had more knowledge about reasons why and what was there and why you were there. So I second everything Emily said.
Excellent. Thank you for that, Sharon. And we appreciate seconds. So please feel free to jump in or put things in the chat if you agree with things. We're also seeing a lot of emojis float up of support. So it's great to just see that many of you agree with this feedback. We can move on to our next slide. And it kind of builds on a little bit of what Sharon just said too, because speaking to that quarterly meeting time, wanted to get your feedback on the MAC and BAC meeting frequency. So the new MAC and BAC will have to meet at least quarterly. Currently, the MAC meets 6 times per year, and about half of the TACs meet 6 times a year, and half meet 4 times a year. Has been shared by a few of you. There's been some variability within that. So wanted to check in with all of you about how the current meeting schedule has worked out, and what are the opportunities and challenges of meeting more often. And for those of you who may not be on the MAC or a TAC, please jump in from other meeting experience. Really just looking to hear from all of you of what a meeting frequency cadence feels right.
One thing.
And Sheila, I see.
Just one thing to emphasize on that, when we think about meeting frequency for both of these groups, the BAC does need to meet before the MAC. So just wanted to restate that point as well as we consider this topic. Sorry, Sharon, go ahead.
No, that's great. It looks like we can note there'll be some alignment between those schedules. So that's good to flag. Sheila, you have your hand up.
Yeah, just by history, the MAC used to meet quarterly, and they changed that. I want to say 10 years ago. Beth Parton was still the chair of the MAC, and they changed it because they did not have enough time to get all the work done that they needed to get done. And I think that people have found that the every other month a good meeting schedule. We have a very full agenda. We've moved our meetings from 2.5 hours to 3 hours, even so. I mean, there's a lot. So I guess one of my concerns, because the TACs try to meet before the MAC meeting as well. So if they have recommendations, so if you're on a TAC and you also are on a BAC or on the MAC, you know, those meetings are doubled essentially.
Well, and for this perspective, we would love to hear just thinking of that BAC and that MAC. And so it sounds like though the 6 times per year is working. Does that feel sufficient? Is that something you've discussed, having more meetings for the MAC, or does the 6 times per year seem like it's been sufficient amount of time?
There is not a groundswell to meet any more frequently than that. Okay. And I think moving it to 3 hours has actually given time for the TACs to make their reports if they're there and so forth. It certainly is more efficient, and we're getting more done. We have more information to share, and we have lots of people. We have well over 100 people on the Zoom every time. So people know that this is the way to get current information about Medicaid, because we have a lot of reports that come from DMS. So I think that the six meetings a year is really pretty ideal. I don't hear anybody also saying we should meet less frequently. So I'm guessing that 6 meetings a year is really would be the choice for those of us who have been on the MAC. And since the BAC has to meet in that same frequency, I think it would be overwhelming for them to have to meet more often than that, quite frankly. But I think they're going to need that many meetings to really become familiar with all of the vernacular and all of the policies and so forth.
Excellent. Thank you, Sheila. And Nicole, have you seen some responses in the Q&A?
Yeah, there's a response in the Q&A aligning, it looks like with Sheila as well, a recommendation for 6 public meetings that are not dictated by the public meeting laws, and also 6 private prep meetings on the off months as part of that recommendation. So basically a monthly meeting cycling back and forth. I think that's it in the Q&A for right now, Shannon.
Great. And I know the next slide, I'd like to have a lot of time to hear from all of you on, so we can move to the next slide. But again, if folks have thoughts or additional thoughts, put it in the Q&A. We'll make sure to capture that. But we'll pull up our next and last slide of questions for all of you to provide feedback on. And again, we've gotten some great feedback on this so far regarding support for MAC and BAC members. So the Commonwealth recognizes the importance of supporting participation of MAC and BAC members with lived Medicaid experience. We can bring in those both questions just because we can think of them as a group. One is, what types of non-financial support will help individuals with lived Medicaid experience participating on the MAC and BAC? For example, orientation training, additional pre-meetings, and we've heard some great advice so far, all-day orientation, support, maybe having Medicaid Medicaid staff present at those meetings. So want to hear additional pieces, or please feel free to reiterate or support what you've already heard. And are there any other types of support for BAC members that should be considered? So again, I'll look to hands raised. Feel free to reiterate good suggestions you've heard earlier in our meeting, and then also feel free to put things in the Q&A and we can read those out for the group. Rachel, I see your hands up.
Thank you so much. Can you hear me?
Yes.
Oh, great. I was wondering currently how many of the members on the MAC or BAC are individuals with lived Medicaid experience.
The earlier slide, we had the requirement that there's 3, and then the BAC is a new group. So kind of looking forward, what would you like to see on the new MAC and that new organization, the BAC, to support that?
I mean, I personally think, you know, it's a fabulous idea because there's so much I mean, obviously I don't have the language you all have and the knowledge of, you know, the institution and the big words you all use, but I have the experience because I live it. And I have so many amazing, and I know so many other waiver recipients and parents of disabled children who can bring so much to the table. So, I mean, I just really think that this is a wonderful, wonderful way to move forward, and you should have as many as possible.
Do you think then, Rachel, with that, thinking about the examples here, there's been some discussion of orientation training, making sure members understand that language and feel empowered to make their voices heard. Anything else you would call out as a support that would really support BAC members in participating?
Well, I'll say this. For me, I think I would just be so honored to be at the table, to hear my voice, to have my voice be heard, because I advocate every day. I'm his advocate. And I know that so many other beneficiaries, especially parents of disabled children, feel the same way. We are our children's advocates. And when our voices are heard, it is just the most amazing thing ever. So I don't really have an answer to your question except for that, but I hope that helps.
It does. No, thank you, Rachel. Thank you for chiming in. Really appreciate it. And then Valerie, I see your hand is up as well.
Well, I agree with Rachel. Being asked to serve is a great honor, but I would also point out that, you know, for many parents, it requires, you know, a 3-hour meeting is going to require someone else be in the home to do the caregiving during that meeting. So that's maybe an extra expense that I have, or I may have to take off work to do a meeting. And I think that, you know, we have to consider that their time is just as valuable, whereas agencies usually have an agency backing them and they're not losing a source of income. You know, parents, on the other hand, sometimes their only source of income is, you know, what they're receiving for caring for their children, or the you know, the job that they have, and not all jobs are going to be allow you to take off that time to spend in a meeting. And we all know that, you know, with the cost of living as it is now, you know, there's just a lot of families who aren't going to be able to take off and do that. So I think something, you know, we need to do something that compensates them for their time and their willingness to serve. And yes, it is a great honor, and many of them would work really hard to try to do that. But I just think it's unfair to ask them to come in and do something for free when everybody else at the table is being paid. And their lived experience is as valuable or more valuable than people who are, other people who are sitting at the table.
Thank you, Valerie. That's great feedback. I appreciate that. And I see, Nicole, you're off mute. Do you have some to add from the Q&A? And then we have one other hand up.
Yeah, there was a good question that came through in the Q&A, and then I'll grab that last person there. This person's feedback says that they'd be interested in hearing what other folks think about how to best compensate BAC members for their time and what alternatives might work when financial compensation could potentially negatively impact their eligibility for public assistance programs. So I don't know, Shannon, if you wanted to comment with anything additional there, or Nicole Kaufman, if you wanted to provide clarification.
Well, maybe to that, Valerie, if you don't mind coming on again, it might be something that you would want to provide some further feedback on from your experience, because you had said, support to offset those costs of care and that loss of income. Do you have any other suggestions, especially considering that additional income might jeopardize eligibility? Valerie, I see. You can go ahead and answer. Yes, you can.
One of the things that we do with our parent advisory councils is we offer them what we call a stipend, which is by law reimbursement for expenses incurred. So if they're paying for childcare for somebody during their, while they're doing a meeting, or if they're, if you're asking them to travel to a meeting, it pays for their internet services during that time. So it depends on how the stipend is provided and how you're labeling it. Because stipends should not have to be reported as income, because it is a reimbursement. It is not it's not a financial incentive for doing business. It is a reimbursement for expenses that have been incurred.
Excellent. Thank you, Valerie, for that additional feedback. And then I see Sharon Hoffman, you have your hand up, and then we'll have one more feedback, and then we will probably hand it back to close out the meeting. But Sharon, please go ahead. Yes.
Can you hear me?
Yes, we can.
Yeah, a couple things actually were really great. Here's one nice thing about being an older adult who is retired is that you do have more time. That being said, I am also low income. And most of my friends who are older women and some men, we both have time, but we don't have a lot of money. So I love the idea of stipends, because again, I'm in a situation where the state pays my Medicare premium. I can't give that benefit up. It makes a huge difference to me. And, but at the same time, and I always say this, and a lot of my friends are the same way, we work more now than when we used to work. and I am a volunteer. I do a lot of volunteer things. And again, I would love to be on some type of committee like this, because I think it's very, very important. And I love the stipend idea, because again, my income is very limited. I have my late husband's Social Security, and that's all I have. Everything else has been jettisoned because of my health issues and things like that. So, but I do have time, and I'm in my right mind. And so again, I love the idea of a stipend. That would be great. Thank you.
Thank you, Sharon, and thanks for that feedback. And then also feel free to, looking at that non-financial support, would love to hear if there's any other suggestions or other types of support from our last two hands up. I'm looking at the clock, so we'll give you about a minute each, but Sheila, your feedback, and then we'll close out with Steve. So Sheila Schuster?
Yeah. Yes, thank you. I would certainly second the recommendations that Emily and her consumer tech have talked about. I would suggest with the orientation that the orientation be done by a combination of DMS staff, but also people from the MAC and people from even some of the TAC so that the BAC people get some broad understanding of how the system as a whole works, and hear some of the issues that are dealt with at the MAC level and from the advocacy standpoint. You know, I think it ought to be a combination, because really the whole system is about Medicaid plus the providers, plus the beneficiaries, plus the advocates, if you will. So I think the orientation ought to reflect that. And the other one is maybe a harebrained idea, but I get a lot of what I bring to the MAC from being at the BHTAC and chairing that. And so I hear from consumers and all kinds of providers and all kinds of advocates. So I know what the current issues are. And I wonder if a BAC member wanted to be in touch with other people in that same waiver or in that same kind of category that they're in, if part of the support might be to have some way for them to be in touch with, to discuss outside of the BAC with people that are also representing that particular group, whether, you know, it's people with acquired brain injury, or it's people that are on the SCL waiver, or it's people that are in need of medical supplies, or whatever group they're representing, if there's some way to get them in touch with other people so that they can really bring all of that to the BAC and to the MAC.
Thank you, Sheila. That's a great suggestion. I'm seeing support from those in the room too. Really appreciate your feedback. And then our last comment, I'll hand it off to Steve for a minute, and then we'll close it out. Steve, your feedback.
There you go.
There we are.
Two things. I think, one, we got to make sure that as BAC members participate and they're in a waiver, they shouldn't have to use their waiver support services to participate on the BAC. They shouldn't have to use whatever it might be, participant different supports. They shouldn't have to use any in-home supports. They shouldn't, so they're not encumbered by that. And secondly, I think we got to really wonder or talk about, should the assistance provided to BAC members be independent of Medicaid? Because I think there'll be some concern by some consumers that I've encountered over the years of being completely forthright. Some consumers are concerned, could there be repercussions for concerns they express about the Medicaid program? So I think, is there an independent entity that could provide the support for the BAC that isn't tied back to the Medicaid program? And I don't think Medicaid staff would do that, but I still believe there's a lot of people who have reservations about speaking candidly if they some potential of impacting their Medicaid benefit.
Thank you, Steve. Really appreciate that. And again, lots and lots of hearts floating up. So I think a lot of people appreciate you sharing that feedback. And we are at time, so I will hand it back to Nicole Kaufman with our closing out slides.
So thank you, everyone, for your comments and questions that came in through the Q&A. And if we could just go to the next slide. Oh, sorry, one more slide. There we go. So I want to make sure everyone sees the QR code. It will be shown again. But if you have your phones handy, the QR code takes you to a survey, right? And so there are a number of questions. There's anything else you want to tell us about the MAC and BAC that we would love to hear from you. That Q&R code will be, the survey will be open until Monday, December 23rd. The QR code will be on the department's website, and then will also be sent out as well, so that information will be readily available. As I mentioned at the start of our call, this presentation and the recording will be on the department's website as well. And then you're probably wondering, right, there was a lot, we referenced a lot of the information, comments, and questions that were coming through the Q&A. We do have a record of all of that feedback. And over the coming weeks, we are going to work on the trends right across these topics that we heard, and provide that information more broadly, okay, to kind of really summarize the feedback we've received to date to develop the MAC and BAC. We also received a lot of enthusiasm, right, to serve on the MAC or BAC. I do want to emphasize that the application process, right, the way that commissioner will select members is in development, right? So there, and then once that process is live, right, that will be publicly available to individuals who are interested. So just wanted to note, if you are eager to join, we're not ignoring you. It's just the process needs to be finalized. So again, if you have your phones and want to click that QR code for the survey, please feel free to do so. But this is not your only chance to access that information, which will be posted shortly. So with that, thank you so much for your time and participation today. We appreciate all of the feedback and have a great rest of your day.